Here is the anatomy of vagina. As we all know, vagina is the part of reproduction system with the function is attract to uteri by vulva and labia as the opening system. Depend on their age and race could affect their shape of vagina. There are the factors related to vaginal aging include estrogen hormone, DNA methylation, and microbiome. For the vaginal rejuvenation, this is not a medical term or medical condition. This is a marketing term to make women more self-conscious about the appearance of their labia and to promote procedures to enhance the appearance or other claims, bladder control, sexual function, and laxity. So, vaginal rejuvenation is not the same as GSM, which is a documented medical condition. And for the topical growth factor are polypeptide or protein that are known to affect collagen biosynthesis. Conclusion and recommendation. Vaginal aging is a natural process of life that is influenced by genetics, hormone, and microbiome.
Hello everybody, welcome to my YouTube channel. I am hoping you are very blessed and good today. In this section, I am going to discuss about the role of topical therapy for vaginal rejuvenation. This is a hot topic to discuss because many women are cautious with their vaginal rejuvenation. Without any further ado, let's check out my material about the role of topical therapy for vaginal rejuvenation.
Today I will present about the role of topical therapy for vaginal rejuvenation. Here is outline topic to discuss about anatomy and histology of vagina, etiology and pathophysiology of vaginal aging, vaginal rejuvenation, topical therapy, include hormonal therapy, non-hormonal therapy, and symptom relievers. Here is the anatomy of vagina. As we all know, vagina is the part of reproduction system with the function is attract to uteri by vulva and labia as the opening system. Depend on their age and race could affect their shape of vagina. Histology of vagina. The vagina is composed of 4 layers. First, superficial non-keratinized stratified. Second, lamina propria connective tissue layer. Third, muscular layer composed of inner circular and outer longitudinal smooth muscle fiber. And the last, adventitia comprised of loose connective collagen and elastin fiber tissue. Changes observed in aging vagina found reduction of collagen and elastin fiber to atrophy, laxity, and loss of vaginal ligation, and destruction of the sebaceous gland and infusion of the mucous membrane to decrease lubrication and increase risk of getting vaginal and urinary tract infection. There are the factors related to vaginal aging include estrogen hormone, DNA methylation, and microbiome. For the genetic, the role of the genetic in vaginal aging due to a decline in DNA methylation and microbiome. As we know, vaginal flora is dominated by the lactobacillus species, and they are a role in the production of lactic acid and hydrogen oxide, which maintain the right pH of the vagina to protection against pathogenic strains. And there are several factors that influence the bacterial flora of the vagina, include lifestyle, hygiene, sex life, menstrual cycle, hormonal status, infection, and most in during menopause, there is a significant decrease of the lactobacillus population, especially in women who complain of genitourinary syndrome of menopause or GSM. Next, the other factor is hormone. The vagina is the target organ for estrogen, and there are 2 receptors, alpha and beta. Alpha receptor were found in the vaginal epithelial and the stromal and smooth muscle cell. And for the beta receptor were found in the epithelial and vascular smooth muscle cell of the vagina. this diagram of hypoestrogenism, there are two conditions that affect hypoestrogenism. The first, this is dyspareunia. The cause of it is combination of high traumatization and high infection. And the other thing is the high urinary tract infection that caused by overgrowth of bacteria and because some factor, and one of them is high for or increasing of vaginal pH, sorry. For the vaginal aging, sign and symptom, the result in the thinning of the epithelium, the smoothing of mucous fold, reduced blood flow, pallor, and greater trauma, as well as decreased epithelial glycogen content, reduced lubrication and dryness. And the other, there is a anatomical change. We can see here, there is the anatomical change, and we can know the loss of elastin fiber, fusion, and hyalization of collagen fiber result in vulva and vaginal laxity, vulva and vaginal atrophy, and loss of vaginal rugation can cause cosmetic complaint, dyspareunia, sexual dysfunction, and anorgasmia. And same as other example, like decreased blood flow can cause traumatic injury, and loss of sebaceous gland and involution of the mucous membrane can cause irritation, burning, dryness, dyspareunia, and so on. GSM, this is caused by hypoestrogenism, and make the symptom like genital symptom, dryness, burning, and irritation, and sexual symptom like of lubrication, discomfort or pain, and impaired function. Also urinary symptom like urgency, dysuria, and recurrent urinary tract infection. It is previously known as atrophic vaginitis and vulvovaginal atrophy. For the vaginal rejuvenation, this is not a medical term or medical condition. This is a marketing term to make women more self-conscious about the appearance of their labia and to promote procedures to enhance the appearance or other claims, bladder control, sexual function, and laxity. So vaginal rejuvenation is not the same as GSM, which is a documented medical condition. The vaginal aging is a part of GSM. In this flowchart, firstly, we ask the patient history, particularly in the sign and symptom, from vaginal symptom and urinary symptom. And then we do the examination for the pelvic, including the vagina. And if we found abnormal vaginal pH and abnormal wood slide, we can see here, like pale royal and green color, then we can say the patient has GSM. There are several ways for the management. There are several ways for the management of the patient. We can give first-line therapy with the hormonal therapy, low-dose vaginal estrogen, and to symptom with the moisturizer and lubricant. Ideal to assess the treatment response VMI or vaginal maturation index, but it is not common. There are three treatments such as the first primary goal are to elevate symptoms that can be used with topical treatment. Reverse atrophic anatomy changes only can be treated with surgery. And the second on local vaginal estrogen therapy has proven to be effective and safe for the moderate to severe GSM. Thirdly, exogenous estrogen is the therapy for prescription therapies. There are few of topical estrogen therapy, include estradiol, estriol, conjugated estrogen, or promestrynegals like cream, ovule, tablet, or ring. And they are specifically indicated for the treatment of vaginal atrophy, including dyspareunia. And they are superior to lubricants and moisturizer in studies lasting at least 6 to 12 months. and the recommended dose is commonly a local daily application for 2 weeks as an attack therapy and twice a week as a maintenance therapy. This is a list of FDA-approved vaginal estrogen products. We can see here the composition for the cream, estradiol, and conjugated estrogen, and for the vaginal ring, estradiol and estradiol acetate, and vaginal tablet, estradiol hemihydrate. And this is the dosing as per labeling. And this is the other product. You can see here, cream and ring, and this is the doses, and this is the application. Vaginal cream. This is the doses of vaginal cream and this way to use vaginal cream. For the localized therapy with an estrogen vaginal cream, typical consists of a loading dose of 2 grams per day for 2 weeks. After the initial therapeutic responses is attained, the frequency can be reduced. However, the amount of cream administered can vary exceeding the recommended daily doses, which is particularly undesirable for patients at high risk. This is about estradiol ring. Here we have how to use estradiol ring. The effective relief of atopic symptom has been consistently documented in randomized control trial with this preparation. The doses and how to use vaginal tablet according to control trial has been shown with a regimen of 125 kg vaginal tablet inserted into the postural vaginal fold once daily for 2 weeks, followed by 125 kg vaginal tablet inserted twice weekly. Randomized control trial indicate that the marketed vaginal tablet is more effective than placebo and as efficacious as the estradiol ring and CE cream. Choice of vaginal AT, local vaginal estrogen treatment is more recommended than systemic vaginal treatment with ultra low dose. There is other therapy that consists of combination of estradiol and lactobacilli and approved in several countries. We can see the here, estradiol, the proliferation and maturation for the epithelial and make the acidification. And for the lactobacilli, for the immune modulation. This is how to use the combination is more effective in reducing urogenital atrophy and recommended as first-line treatment, first-line therapy for urogenital aging and also safety. This is the summary of publication supporting the use of this combination for vaginal atrophy. And we can see here the outcome. Some of them are improvement. Next, we are going to non-hormonal topical therapy for vaginal aging. First thing is phytoestrogen. They are produced by plants who possess structural and functional properties similar to those estrogen. And there are 3 main classes, isoflavone, lignan, and comestan. As we know, isoflavone, especially genistein, are the best studied. They bind directly to estrogen receptor with exert both agonist and antagonist effect. For the intravaginal isoflavone gel was reported to be effective to relieve both moderate and intense menopausal symptoms, particularly vaginal dryness and dyspareunia. It showed that phytoestrogen, an effective treatment for vaginal atrophy with isoflavone vaginal gel based on study that we have here. We can see here for the isoflavone vaginal gel is similar with the conjugated equine estrogen cream and superior to that placebo gel. And improvement isoflavone gel for the dryness, for dyspareunia, and to maturation value index. On the other hand, in systemic reviews in 2015 state that most study on topical isoflavone reported only maturation value. Meanwhile, maturation index is more reflective of estrogen effect and MV detailing with the control vaginal application. Basically, more evidence are needed to support the use of topical isoflavone for vaginal atrophy. Hyaluronic acid has been considered as alternative therapy for vaginal atrophy and the potential to retain water molecules and helps to form extracellular water film and maintain water balance repair vaginal dryness. This is the original article. There are comparison for the comparison of the hyaluronic acid vaginal cream and conjugated estrogen. And the results of the study show that relief of vaginal dryness and urinary incontinence were improved in the hyaluronic acid but not in the CE cream group. And the improvement of PCMI and of the composite score of vaginal symptom was more pronounced in the hyaluronic acid than in the CE group. This is a topical peptides. Peptides are present in anti-aging products in several forms: signal peptides to stimulate matrix protein production, collagen and elastin, and cell growth, and carrier peptides as transportation facilitator for trace element, and neurotransmitter inhibiting peptides to inhibit acetylcholine release at the neuromuscular junction, and enzyme inhibiting peptides to reduce the activity of enzymes that are involved in skin aging. Here is a list of peptides in signal peptide known to be the most widely used. This is what I found on a marketing page of vulva mask and labia serum in which one of the product palmitol hexapeptide. However, there has not been a good quality clinical evidence that peptide can act solely to rejuvenate the vagina. So we must be careful to choose the product. We must choose a good quality clinical evidence. And for the topical growth factor are polypeptide or protein that are known to affect collagen biosynthesis. Use of topical growth factor are known to relieve vaginal dryness on sooty irritation, improve elasticity, tighten and firm the vaginal walls, for the enhanced female sexual arousal and intercourse rejuvenate vaginal function, and for the recommendation can be used twice weekly until symptoms resolve. Later once a month to maintain. And we can see here for the topical growth factor, more improvement to mucosa thickness, secretion, and lubrication. Compare estrogen, lubricant, and placebo gel. There is the other product for the symptom relievers. First, we have vaginal lubricants. And vaginal lubricants based on water, silicone, mineral oil, or plant oil and are used by application to the vagina, vulva, and or penis prior to or during sexual activity. They work by reducing friction and therefore trauma to the tissue and reduce or alleviate discomfort and pain. They are beneficial for women whose dryness is primarily a concern during sex. Compared to moisturizer, they differ in their composition and there is concern over the attribute of some product. Incidentally, many lubricants do not publish their ingredient on the label. And we have vaginal moisturizer. They rehydrate dry mucosal tissue and are absorbed into the skin and adhered to the vaginal lining to mimicking vaginal secretion. And the frequency of usage is based on the severity of symptom. Compared to lubricant, they typically relieve the symptom for up to 2 until 3 days. And for the mechanism, they change the fluid content of the endometrium and lowering the pH to result in ability to maintain vaginal moisture and acidity. It is a good choice for women who have more persistent discomfort or irritation. Based on the study that we have here in the efficacy of vaginal estradiol or vaginal moisturizer versus placebo, proven us the result that there is no significant difference in the change from baseline in severity score between estradiol, moisturizer, or placebo, but there is an important of PCMI with the help of hyaluronic acid than in the CE group. We can see here. And things to consider regarding topical therapy for vaginal rejuvenation. Many women who are prescribed vaginal therapy seem unsatisfied with treatment as continuation rates are low. In several studies, adherence to tablets was better than vaginal cream. Then we can see from the report of the saline tablet versus vaginal cream, and more salt for the tablet than the cream. Conclusion and recommendation. Vaginal aging is natural process of life that is influenced by genetics, hormone, and microbiome. A constellation of signs and symptoms of estrogen deficient in menopausal women is clinically known as genitourinary syndrome of menopause or GSM. And vaginal rejuvenation consists of procedures to enhance the appearance other like bladder control, sexual function, and laxity. Generally, topical therapy of vaginal rejuvenation consists of hormonal and non-hormonal therapy. And topical therapy for vaginal aging still lack of a good clinical evidence. To date, we know this topical therapy relieves the symptom but not reversing the change associated with aging. Okay, thank you all participants for your attention, and I hope you find this presentation useful in your practice. Stay safe and stay positive. Thank you.
This is all my exclusive explanation about the rule of topical therapy for vaginal rejuvenation, as you can study from what did I present you about. I hope you are satisfied with the material and the presentation. After that, don't forget to click subscribe, like, share, and comment below, and see you next in my other video. Have a nice day everyone, and stay positive, stay safe. Bye bye.